Myocardial infarction. Definition: Myocardial infarction is necrosis of cardiac myocyte. So, necrosis of cardiomyocytes is called myocardial infarction. Causes: the causes of myocardial infarction is usually due to rupture of an atherosclerotic plaque with thrombosis and complete occlusion of a coronary artery. Other causes include coronary artery vasospasm due to prinzmetal angina or cocaine use, emboli and vesiculitis, for example Kawasaki disease. Clinical feature: clinical feature include severe crushing chest pain lasting greater than 20 minutes that radiate to the left arm or jaw. Diaphoresis, dyspnea symptoms are not relieved by nitroglycerin. Sites of myocardial infarction. Infarction usually involve in left ventricle, right ventricle, and both atria are generally spared. Occlusion of left anterior descending artery lead to infarction of the anterior wall and anterior septum of the left ventricle. Left anterior descending artery is most commonly involved artery in myocardial infarction. 45% cases occur. Occlusion of right coronary artery lead to infarction of the posterior wall, posterior septum and papillary muscle of the left ventricle. Right coronary artery is the second most commonly involved artery in myocardial infarction. Occlusion of left circumflex artery lead to infarction of lateral wall of the left ventricle. Initial phase of infarction lead to subendocardial necrosis involving less than 50% of myocardial thickness. Subendocardial infarction. EKG show ST segment depression. Continued or severe ischemia lead to transmural necrosis involving most of myocardial wall. Transmural infarction. EKG show ST segment elevation. Laboratory test. Laboratory test detect elevated cardiac enzyme. Troponin 1 is the most sensitive and specific marker, gold standard for myocardial infarction. Level rise 2 to 4 hours after infarction. Peak level at 24 hours and return to normal by 7 to 10 days. CKMB, creatinine kinase myocardial band, is useful for detecting reinfarction that occur days after initial infarction. Creatinine kinase myocardial band level rise 4 to 6 hours after infarction, peak at 24 hours and return to normal by 72 hours. Treatment include aspirin and or heparin limit thrombosis, supplemental O2 to minimize ischemia, nitrates vasodilate vein and coronary arteries, beta blocker slow heart rate decreasing O2 demand and risk for arrhythmia, ACE inhibitor decrease left ventricle dilation, fibrinolysis or angioplasty is done for opening block vessel.